At every point in time, 23% of the world's population suffers from back pain. 80% of people in the world will at some point or the other in their lifetime suffer from back pain. It is one of the most common reasons why people come to the hospital. The commonly affected people are people in their middle and older ages. However, these days, more and more young people come to the hospital because of back pain. Hello everyone and welcome back to my channel. I'm Dr. Amirah Sonny. I'm going to be making a series of videos to help you make better choices in relation to your health. I personally know two people who are dear to me, that are very important to me, who have undergone surgeries on their back. And that is one of the reasons why I chose this topic to be the first one that I'm making in my series of health videos. Now we're going to talk about the common causes of back pain. They can be broadly categorized into the mechanical causes and the non-mechanical causes. The mechanical causes of back pain take 90% of the causes. That is, if you put 100 people with back pain, if you line them up, 90 of them would have mechanical reasons for their back pain. Or if you put 10 people with back pain, 9 of them will have it. So that is the most common cause of back pain. And then we have the other causes. So I'm going to try to talk about many of these causes so that we will now be able to look at how we're going to prevent them from happening to people who don't have back pain at this time. And for people who already have back pain, how can they make certain lifestyle changes that will help them to improve the back pain and to at least reduce how worse it gets. Mechanical can be about the way that you have used your body over time. It can be because you've had accidents, your posture, the way you carry your bag, and all of these things can affect your back. Another cause of back pain is infections. Some people who have tuberculosis, tuberculosis affects the lungs. So you would be wondering, this is in the chest. But this thing can spread and go to the back and cause back pain. This is called Pott's disease. Some other inflammatory conditions, I have decided that I'm not going to bore you with medical terms, so I'm just going to avoid talking about all of these ones, because the most common cause of back pain generally is the mechanical part, which causes 90% of cases of back pain. So I won't bore you with other things, but you need to also know that cancers cause back pain, especially in men. People who have like prostate cancer, this cancer can spread to the back. If it is not early detected or treated early, it can spread to the back. Other kinds of cancers can also spread to the back, but this is common in prostate cancer and affects men and goes to their back. Cancers can also, have the back as their original initial site. So cancers are a common cause of back pain. There are also other causes. In people, metabolic causes, like in people who have low calcium levels, in postmenopausal women, they have a condition called osteoporosis, where the minerals in their bone are lower than usual, are lower than normal, and this makes their bones brittle and then leads to the bone breaking down. There are other causes, but I am just going to talk about, these ones because they are the common causes that we see, especially in our environment. Now, how do we prevent this back pain? And in people who already have back pain, how do we make sure that they can do certain things differently to try not to worsen the pain and to improve their condition generally? And this is the main focus of my video. Most of my videos are going to be about prevention, how to prevent this from happening in people who do not have the condition as we speak. And for people who already have it, how can they live, better as they deal with this pain. If you have seen people with this back pain, it can be from a mild pain in some people to very, very severe pain that requires surgery in others. Unfortunately, not many of these people can actually afford to have the surgery done. So they have to live for a very long time dealing with this pain. Now, to the preventive measures. I'm going to start by talking about the mechanical causes of back pain. And I'm going to use an analogy to describe this. Imagine that you buy a car. Forget the fact that most people now buy Tokumbo cars. Fairly used cars. Whether fairly used or a new car. If you buy a car, after a while, you're going to need to start, making changes because wear and tear will start to happen to some parts of the car and they will start to need changes because things will start happening to the car. And what will happen to the car will be determined by how well you have used the car. Have you always driven the car on tarred roads or have you always driven them on bad roads? What is the duration of use of the car and other things like that will determine how fast you need to make changes to the car or have repairs on the car. So this also happens to the body. This same back is what you have been using for all of the years that you have spent on earth. So over time, the back will start to have what we call degenerative changes. So once the way these degenerative changes will occur would vary in people depending on so many other life factors. It can be from traumatic experiences like road accidents, car accidents, assaults. So what do you do in these situations? What you do in these situations is to prevent these accidents from happening. Follow traffic laws, avoid situations that put you at risk of someone assaulting you. And if two people are fighting, please don't try and come in between them. In my experience, people who come in between people that are fighting are more likely to even have injuries than the people that are fighting. So if you can, as much as possible, please try to avoid toxic circumstances, situations that can put you in a position to be assaulted. Please just try and avoid it. Another thing we need to talk about is posture. The way that you carry your body, the way that you carry yourself, the way that you use your body matters a lot. And I'm going to give you an example of myself. I remember when I was in secondary school, on one of those days I was coming back from school, I had my backpack on my back. And when I got into the house, I saw my grandmother, may God bless her soul. She had arrived from Ilorin at the time and she saw me. She was like, "Oh, my daughter, you're beautiful. You're tall. Please do not lean forward while carrying your bag." Because I was carrying this heavy backpack, had my books, so many of my books in it. So I was leaning forward. So since that day, I learned that I had to always stand straight with my back straight. And since then, I have maintained a very good posture. So this is what you should also teach your children. Many people carry things in bags, tote bags, especially in women. You carry the bags and then you carry them on one shoulder and find yourself tilting to one side of the body. Over time, you're going to have back pain if you continue to carry things this way because you're going to tilt to one side. The best way to carry things is to carry them in a backpack. Because with the backpack, the weights are evenly distributed on the back. However, the problem with backpacks is, and especially I see this in children, they are too heavy. Children should not carry more than 10 to 20% of their weight on their back. So as a parent, if you have a home scale, please step on it and check your weight. Step out of the scale and then carry your child's backpack. Step back on the scale. Check the difference between the two readings. That will tell you the weight of your child's, the weight that your child is carrying in that backpack. And that weight, make sure it is not more than 10 to 20% of their weight. If it is more than that, then it is too much. And this is going to affect their posture in the long run and may increase their chances of having back pain. So the way we carry load matters. And then the posture matters, because it is, especially people that are tall are prone to, leaning forward. I know that people that are shorter can also, have such posture, but I see it commonly in taller people. They kind of lean forward because they are tall. Try and maintain a straight gait. Another thing is that you have to change the things that you do and how you do them. You have to make sure that you do not bend your back for any reason. So I'll make use of some examples of the things that we do on a daily basis to tell you how not to bend your back. Whatever activity you're doing that will make you bend your back, it's either you bring what you're doing closer to you or you go low to that thing so that you do not have to bend your back. Okay, so if you're having if you want to take your bath, try and make use of a shower. And if you're using a bucket and a bowl, please put it on a platform so that as you scoop the water, you just pour it on yourself. You don't have to bend to scoop the water. And if that is not possible, then you should sit down, get a stool and sit in your bathroom so that as you scoop, you're just pouring on yourself. Some of my patients say that they sit on their toilet bowl when I talk to them about this. So whatever is going to work for you, that will make sure that you do not bend your back, please make that change. As you can see these days, we have brooms that have long handles, although I see that the handles are not even long enough, but they are better than the brooms we used to use in the past. I remember when we were kids, I am the type of person that just likes to sweep with the tip of the broom, and then you'd hear elderly people saying, bend down, bend your back. That bending is not good for the back. It is better to use brooms like this with long handles that you can use to sweep without bending the back. Same for mopping sticks. They are better than bending down to clean the floor. If something falls to the ground and you want to pick it, don't bend your back to pick it. Squat. You're going to squat and then pick it. If people have accidents on the road, they may have had, injury to the back. The way that people trying to help, the Good Samaritans, the way that they carry them may in the long run affect their back. So the way to carry them is to roll them onto a stretcher and then lift them at the same time, lifting them at the same time with a stretcher. That is the way to lift them in order to protect their back. When you look at the hospital settings, there are these desks that doctors write on that are attached. I know in beds, attached to the beds in the hospital, you can see that these are things that you can raise up to the level of a standing person so that they don't have to bend their backs. Now, if you're someone whose job makes you stand for a very long time, make sure that you take breaks. Don't just stand the whole day, 8 hours a day, standing in one position or sitting in one position. All of this in the long run affect the back. Another thing that I really want to talk about is weight loss. The more your weight, the more likely it is that you will have back pain. And so losing weight is one of the ways that you can prevent back pain. And if you already have back pain, losing weight is very important for improving the back pain. Now, another thing that is very important is exercises. It is very important to exercise. And mind you, there's a difference between exercising and weight loss. And we are going to talk about that in another video, God willing. So it is very important to do exercises as a way of preventing and also as a way of improving your health generally and improving your back pain. Other things that you need to do, because I mentioned tuberculosis as one of the causes of back pain, is if you know someone who has back pain and maybe the person has had TB in the past, please, they should go to the hospital. Yes, because, and then for cancer, prostate cancer, there are different screening tests for different types of cancers. So once you reach the age, or once you reach the time, or when you go for your annual checks, ask whether you are due for certain cancer screening. In the future, hopefully, I'm going to make videos talking about cancers. I'm going to, by God's grace, God willing, I'm going to talk about prostate cancer, talk about cervical cancer, talk about breast cancer in the future. So it is very important that any kind of cancer is detected early. When they are detected early, treatment should also start early so that the cancers do not spread and then cause back pain. Another thing is that many people who have back pain then start to take drugs. They just start to take different painkillers, go to this chemist, collect a painkiller, go to the next person, collect a painkiller. Then at the end of the day, the effect that these drugs have on them, some can develop peptic ulcers, they can start vomiting blood or stooling blood, they can even develop cancer of the stomach if they have untreated ulcer of the stomach, for a very, very long time. So please, if you have back pain and you've taken drugs and you've done this and that, and it's 4 weeks, 6 weeks, 8 weeks, no improvement, please come to the hospital. Speak with a doctor so that you can be properly evaluated. Your case may not just be the mechanical that we have been talking about. It may just be something serious that you need to have more investigations done to detect so that you can get the treatment that you need. Even for mechanical causes, some may eventually need more interventions than just taking drugs. And then the drug for Mr. A may not be the drug that is appropriate for Mr. B. God willing, in the future, I'm going to talk about drugs and how to take them and the mistakes that people are making in taking drugs. So please and please and please, I've chosen this topic in hope that you can look at these lifestyle modification exercises that I've talked about and adhere to them. Don't bend your back. If you have back pain for a very long time, please come to the hospital for proper evaluation, because your back pain, you may just be the 1 out of 10 whose back pain is not from a mechanical cause. And even if it is from a mechanical cause, get properly evaluated. If you have taken painkillers for a long time and your pain is not resolving, so that you can be properly evaluated. Thank you so much for watching this video. This is my first of many. If you like this video, or even if you don't, and you know that there are people around you who are going to benefit from it, please share this video with them. Please subscribe to my channel. Follow my social media pages so that you can get to know when new videos drop. My next video is going to be on hypertension, and I assure you, you do not want to miss this next video. Thank you so much for being a part of this. I look forward to seeing you again next time. So I hope that you will follow my WhatsApp channel, because every time I drop a video, it will go to the WhatsApp channel, my Facebook page. So if you like this video, if you are enjoying this video, please follow my social media pages and you will be able to get videos as they drop.